Hola, mi amor. Today we're checking out more of the Pits. I'm sorry I'm late. I've been busy. Things happen. Checking out more episodes. The last episode showed me that this show is more realistic than other, like, medical dramas, I guess. You know what I mean? Let's go. I'm really excited. Oh, this is the flashback.
Robbie, college kid in respiratory distress is here.
Right.
You okay?
Yep. I wanted to talk to the patient at Central 12 Summit, but he took off.
Is there a problem?
According to Mom, she found a list of high school girls that he'd like to eliminate.
What's wrong with kids these days?
You mean besides social media and the worldwide pandemic and the environmental crisis?
Yeah, you're
gun
fucking
violence.
fountain of hope today, aren't you?
Nick Bradley, 19, found unresponsive by parents. No meds, no allergies. On arrival, he was barely breathing with pinpoint pupils, bradycardic at 38.
Pupils responded to Narcan, but we tubed him when his respirations didn't pick up.
Any drugs or alcohol on the scene?
No,
Signs of trauma?
nothing.
Okay, open your eyes, Nick. On three. 1, 2, 3.
Where was he found?
In bed by his mom.
Pupils are 6 millimeters, non-reactive.
Heart rate 64, BP is cycling.
No response to pain, GCS 3.
Does that fit any toxidrome?
No. If it was just opiates with Narcan, he'd be breathing on his own.
Beta blockers shouldn't give pinpoint pupils.
Maybe parents had some prescription meds in their bathroom.
They're on their way.
ETA 5 minutes. Code trauma tier 1, ETA 5 minutes.
That's a stand-up scooter rider versus car door, no helmet.
No blood in the belly, no pericardial effusion, and lungs are up.
Hemo Q's good, 15. BP 84 over 58.
Okay. What's your plan, Dr. Collins?
You know what's crazy? This has nothing to do, but actually kinda, because they said scooter and no helmet. I ride the bike, right? Constantly. And that's something that I stress about a lot. Because you don't really consider like a bike as something you could have an accident on. It's a bike, you know what I mean? Like it's not a motorcycle, it's a bicycle. But like my top speed on the bike is 30 kilometers. Imagine going 30 and stopping immediately. That would F you up for life. So yeah, lately I've been really stressing about the whole helmet thing. Whatever, let's go back.
Push dose epi, 0.1 milligram. Foley for urine, stabilized for CT, and throw a wide
Still not
net.
gonna wear it, you know? I'm cool.
Where are we going now?
We need the room for someone else, but you can rest in the hall till we get your labs back.
Parents must be proud. Having a son who's a doctor.
Yeah, I guess. You know, I was the first one in my family to go to college, and they sacrificed a lot to get me here. How's your pain, Mr. Milton?
I'm fine. Could use a latte, though.
Well, that could bring back the gallstone pain.
How about a bourbon?
It's barely 8 o'clock. How about some ice chips?
No, thanks. I prefer my whiskey neat.
Yeah, that's not happening.
Systolic back down to 90.
Another 0.1 of epi.
Flaccid paralysis of all 4 extremities.
No eye movement with ice water.
So no brainstem function.
Due to?
Hypoxic injury, massive hemorrhage. Samara, escort him to CT. Take the drug box with you.
Call me if you need me. Hey, are you okay?
Yep.
You sure?
Have you ever had to worry about me?
No, but never hurts to check in. It's part of my job.
Consider yourself checked in.
She's
Okay.
pregnant, but do they have a relationship together? Because
Got
I feel
something?
like they're
I
like
had
they
a case
date.
for Dr. Collins.
May I see it?
Yeah. 68-year-old male, history of hypertension, 1 hour of right upper quadrant pain after eating a fatty meal, now resolved. Afebrile, non-tender. There was a gallstone present on POCUS. EKG shows no acute ischemic changes, but I'm still waiting on LFTs and lipase.
Why did you order the EKG?
The nurse suggested it to rule out any cardiac issues.
Well, good call on both your parts. Nurses know what they're doing. Never hesitate to listen to them. Come find me when those labs are back. Hey, how's that finger?
Oh, it's nothing.
Dr. Robbie.
Yep.
The son and daughter of Mr. Spencer from assisted living. They're here.
Okay, I'll be right there.
It's really cool. Like, you have to pay attention on the previous episode because it's a continuous thing.
Your father has pneumonia and a condition called sepsis.
What is that exactly?
It means that the bacteria has spread from his lung to his bloodstream. So far, he's been responding well to treatment.
Hey, Pop. It's Helen and Jeremy.
Jeremy. Hillary. Boob. Bud. It's the nowhere man from Yellow Submarine. It's what he used to call me when I didn't do my homework.
Is this his baseline?
He has good days and bad days.
Why don't we step out for one more second? So your father came in with low blood pressure, which is improving.
Can he go back to assisted living?
Eventually, we hope so. Your dad has an advanced directive expressing his wishes, which says that IV fluids and medications are okay, but no artificial life support, no CPR.
I mean, he doesn't want a bunch of machines keeping him alive.
Okay. Then we will continue with oxygen and IV fluids and antibiotics. But if his lungs stop working, we're not going to place a tube in his windpipe for a breathing machine.
But pneumonia is treatable.
Most of the time it is.
But if he can get better in a week, then put him on a machine.
That's not what he wanted.
Do either of you have durable power of attorney for healthcare?
Yes.
We both do.
Okay. Well, this is a decision that does not need to be made right now. Why don't you think about it? Talk about it. If things get worse, sometimes allowing for a comfortable natural death can be the most humane path.
No routine cases until we assess the tier 1.
Would you do it? You know? Like, you're on deathbed. Do you want them to bring you back? Especially if you're that old? Barely functioning, barely doing anything. I mean, I'm saying this with the comfort of youth and health, which is, may God bless me and continuously. I don't know if that was a prayer, but hey, speak from the heart. But seriously, at that point, I really think about, like, what would you do at that time? You know? I don't want to stay on just to be staying on, you know? No, if I have a good quality of health, yeah, continue. If not, don't pull the plug. No, pull the trigger. You know, come in gangster style. I want like mafiosos. I want to hire a couple of hitmen. Take me out. Make it gangster, son. I'll be like, no way. Adios. You know what I mean? Like make my life at that time peak. You know what I mean? I could be crazy, but that's what I think. What would you do?
Thanks.
Dr. Langdon?
So, how's the VA?
Yeah, it was good. Challenging. I learned a ton. I just think maybe it should be mandatory that all doctors spend time there, like on a regular basis, because of all they've sacrificed for us.
That's a nice thought. How'd you choose the Pitt?
Oh, I have a sister with special needs, and she got into this really great facility here in Pittsburgh. And PTMC has such a great reputation. I thought, it'd be a good
Can I
fit.
present my headache to you?
Yeah. What do you got?
A 36-year-old woman with severe headache due to paracervical trigger point. Her pain went from 11 to 0 after 2 cc's of iammarcaine.
Wait. You did a trigger point injection before presenting the case?
Yeah.
Interns always present first.
I spent a month at the pain
No,
clinic.
it's not okay.
I'm very comfortable.
It's definitely not okay.
23-year-old Ben Kemper, no helmet, got doored riding an e-scooter. Neck versus handlebar, then face planted to the pavement. Obvious facial fractures, but alert and oriented with good vitals.
Here we go. 1, 2, 3. How we doing, Ben?
Blood back in my throat.
That's probably from the nosebleed. Short, rapid rhino, please.
Tachy at 120, pulse ox borderline at 90.
Blood by at 15 liters for now.
Neck contusion, larynx shifted to the right, no crepitance.
4 of morphine. I'm gonna stick something in your nose to stop the bleeding.
No hemotympanum.
Inflate the balloon. How about now, Ben?
Better.
What's up?
Good vitals, A&O. Let's have a look.
Oh!
Ouch.
Floating face.
Before 3 fracture.
You don't see that every day. Okay, let's prep for an airway. Double setup just in case.
Ugh. Floating face. I don't want to hear that. In my lifetime, I don't want to hear that.
Nice work. Thanks. All right, Mr. Tagari, you are good to go.
Oh, thank you. Remember, 10% off for doctors and nurses.
I'm a student doctor.
All right, sorry. I hit my head, remember?
Well, my son loves pizza, so I will take you up on it for sure.
Thank you.
Okay? Thank
Thank
you.
you.
Wait for a nurse.
Okay, thanks.
I just realized it sounds like I always feed my kid junk food.
Oh.
No? Pizza, s'mores.
No, please. I like pizza and s'mores. Who doesn't? How many kids do you have?
Just one. Harrison. He's 11 now.
What does your husband do?
No husband. Just me and my son. I take it you don't have kids? I don't mean on account of your age. Or, I don't know, maybe I do. I mean, most medical students don't have kids.
Yeah, no. No kids. Just, not even a boyfriend. It's just school for now.
Yeah. That'll keep you pretty busy. I do not miss it.
Must have been difficult as a young mother.
It had its moments, but my life has been full of challenges. Med school was not one of the hardest, by far. It was one of the most rewarding, though. Other than having my son.
Hey, facial lack with a possible foreign object in the eye, which is always a solid 7 on the WMMV scale. What makes Mateo vomit?
You okay?
Yeah, he's funny.
Wow, wow,
nurse.
wow, wow,
Mateo, you can say something.
Wow, wow. I see you. I see you.
Yeah,
Doctor.
a foreign object in the eye could be really serious.
Mm-hmm. Yeah, let's focus on that. That was perfect.
Hey, fruitcake. Hey, I'm talking to you, fruitcake.
Myrna, I've told you 100 times, my name is Dr. Robbie.
You want to see my vagina?
I have already seen it, and once was enough. Thank you.
Robbie, parents of Nick Bradley, the OD teen, are here.
Okay, park him in trauma 1. He's not back from CT yet, but I'll be right there in a minute.
You behaving yourself, Myrna? Oh, yes, ma'am.
How we doing?
Ketamine and sucks on board.
Pulse ox holding at 94. Prepping the neck just in case.
Let's have a look. A little deeper.
Lots of swelling. I can't see the cords.
To the right. The left. Yeah, really distorted from the trauma, and the demon's only going to get worse.
Which is why we should crike.
You don't crike a laryngeal fracture. Don't listen to Edwina Scissorhands here. If they can't cut it, surgery doesn't know how to fix it.
The contusion is high at the thyroid cartilage, so you just stand there looking pretty, ER Ken, and let me fix this.
We're down to 85.
All right, pull out eye gel, bag and crike.
Eye gel, please.
Turn off the alarm.
I've never done a crike before.
No, Mel will do the crike. You've already had a busy morning. Glove up, Mel.
No, I'm doing the crike, doctor.
You would be doing it, doctor, if it wasn't an odd day. Surgery gets even days, ED gets odd days. You know this. For crike's sake.
It's because you're all fucking odd down here.
Okay, teamwork, please. Let's focus on the patient.
I so appreciate your gracious understanding.
I'll assist in case she screws up.
Yolanda, play nice.
Stats are up with the eye gel.
You ready? Hello?
Oh, hello.
You've done this?
Yes, in the cadaver lab.
Let's hope that's not where this poor soul ends up. We'll do an open technique since we have a minute.
Okay. Okay, you're gonna be making a vertical incision to avoid the jugulars and the carotids. Good. If this was a crike that needed to happen in seconds, you could use a 10 blade, your finger, and a bougie.
This is called a Wheatlander, and this is your tray cook.
C-spine, head CT, OMF, start a propofol drip. Okay, now we're gonna make a horizontal incision across the cricothyroid membrane.
4-0 Shiley next. Get ready to bag the crike.
Yeah, good.
Oh, excuse me. No worries.
End title CO2 is yellow.
Yellow is yes. Nicely done. Sew it in. Okay. I will be next door.
Does your resident know how to suture, or do I need to teach?
You're all class, Yo-Yo.
I know.
Yeah.
Thanks. That means a lot of nothing coming from you.
Mel, you okay?
If you're done fighting.
We're not fighting. This is playing. Langdon's too soft to fight.
Oh, yeah. I have nothing but respect for Dr. Garcia. In fact, I think she would make a wonderful hostess at Applebee's.
Later, odds.
Let's go.
Okay, thanks. Just received word your son's head CT is normal and he's maintaining a good heart rate.
You got him
good
back.
Blood pressure.
Thank you, thank God.
Right now, he's unconscious with a tube in his throat for oxygen. Why don't we step out for a minute while they get him settled, and then you can come back. You can sit with him as long as you want.
Nikki, it's Mama. I'm here, babe.
You're doing great, son.
Bloom.
Okay, let's step outside.
Okay.
I'm guessing that's not good.
So, we don't know how long he was at home without breathing.
He's breathing now.
Not on his own.
But he's gonna wake up.
We certainly hope so. We're gonna know better after we get some more test results back. Are you sure that he didn't take anything that could have caused this?
No, he's a good kid. He's in college. He has a part-time job. He even chose to live at home so he can focus on school.
That doesn't
Dr.
matter.
Robbie, from the urine.
What's that?
It's a drug test, and it is positive for fentanyl.
No, that is impossible. Nick doesn't do drugs.
There are a lot of pills that are sold illegally that have fentanyl, not just painkillers. Xanax, Ativan.
No, not our son.
Well, maybe he didn't know that he took something with fentanyl. I don't know. The hows and the whys don't really matter. What matters is spending time with Nick. We've got some more tests to run. We'll know our options after that. But in the meantime, why don't you take a seat, talk to him?
Can he hear us?
You know, we're never really sure, so you should just assume that he can. And we'll come find you as soon as we know more, okay?
Man, the actor really has this
Can we move Nick
face
Bradley to the
I've
private
seen
room?
so much.
Like you're gonna make it?
I can't take this anymore.
Didn't you
I love
respond
it.
to Narcan?
I think his pinpoint pupils just grew into balloon pupils from brainstem death.
Shit.
Yeah, not much older than Jake.
Don't go there.
Hard not to sometimes.
Mr. Spencer's room.
Hey, Robbie. Teresa, the mother of the young man David who bolted, she's asking for her son.
Okay, I'll be there in a minute.
What is happening?
His oxygen levels are dropping. Mr. Spencer, how are you feeling?
I don't remember where I parked.
Mr. Spencer, do you know where you are?
It's so loud in here.
Dad, do you know where you are?
Dad, look at me. What's my name?
I don't know where my car is.
IPAP 15/5. Step out.
What's BiPAP?
It is a pressurized air mask that can improve his oxygen. Either his pneumonia is getting worse or his heart couldn't handle the fluids that we gave him to treat the sepsis. His lungs are filling up with fluid.
Can't you take the fluid away?
Not without his blood pressure crashing with very bad consequences. So let's just hope the BiPAP works.
And if it doesn't?
Then I
con
would need
Dios,
to
my
know
friend.
your decision about using a breathing machine.
We're still talking about it.
Well, we know he expressed his wishes in writing. Do not intubate.
We're thinking try it for a week.
That would be a very painful week. He wouldn't get a lot of rest with all the monitors and all the blood tests. He might need to be sedated. He might need to be restrained because he'd be in an unfamiliar place with a very uncomfortable tube down his throat. And he wouldn't really know what was happening. Elderly patients can often develop psychosis.
But he might get better.
Or he might get worse. What would you do?
Don't ask
I
the
really
doctor.
can't answer that for you. This
Yeah.
is your father. That's your decision to make. I can guarantee you that we will keep him as comfortable as possible if a natural death is what you choose.
But he's not your father. And he can recover from this.
What my sister means is that we're still deciding the best thing to do.
Well, the sooner you decide, the better. I'm really sorry. I wish there was more that I could do.
Dog, this is an idea, all right? And it will benefit society for the best. I think this is actually the best idea I've ever come up with. Instead of, right, like demonizing the serial killers in the world. We use them in hospitals. You know, you just don't want to live anymore. You just send in a serial killer of your choice. We benefit both society. We coexist instead of constantly like, oh, demonize this guy for trying to kill people and eat them. Like, make a meal out of it. That would be great. You know, who do we have in the rotation? Ah, it's Hannibal. Oh man, he's gonna eat my patient. You know what I mean? Then you got a guy who was like, oh, I wear skins. Not here. In the basement. You got the sewing machine there. You're like, can you imagine the conversations? Hilarious. I need credit. If somebody makes this like a thing, I need credit. I solved a problem here. I solved an issue in society.
I'm not sure that he has that much time left.
Dr. Robbie?
The Nepal girl.
You were right. She can't say whether she was bumped by accident or shoved on purpose.
No other witnesses?
Nah, not really. We pull security footage, maybe we'll find something. Hopefully she tripped. I don't mean I hope she tripped. I mean I hope she wasn't pushed on purpose.
That would make this a hate crime.
Yes, ma'am.
Damn.
Doctor, sorry. I'm sorry.
No harm, no foul.
Will you let me know if she says anything else?
Will do.
At the risk of seeming...
Then you probably shouldn't.
And I just...
No, trust me.
How do you know?
I just know.
I just wanted to...
I know.
It's done.
Look, I'll let you know if she says anything else that could be important to your investigation.
Damn.
Thank you. No, for the record.
No.
Any luck getting our psych boarders upstairs?
Yeah, right. At least the Kraken's still sleeping.
Is it me or was that officer?
No. Mm-mm.
What? You don't even know
what you were gonna say?
Maybe you do. You seem nice.
Absolutely not. Mm-mm. There is no possible scenario in which you and I have this conversation. You, of all people, should know better.
I was...
No. Just walk away. Best possible scenario, just keep on walking.
You gotta lay off mixing Adderall and energy drinks.
Trust me, I will.
All right. Thanks. That's the thing about emergency medicine. You never know what you're gonna get. And we get everything.
Is that why you chose it?
Maybe a little. I also get to pick my shifts, which for a single mother is amazing. But mostly, I just like the people, you know? They're always there when you need them. You wouldn't want to be a part of that, you know?
This is the monitoring center. We see that you're not in your inclusion zone. Do you have permission to be outside this area?
Yes, I am at work. Just like last time and the time before that. I'll be right back. What is the point of this fucking thing if it doesn't even work?
Honestly, if my doctor has like an ankle monitor, I'll vibe with that. Yeah, let's go.
You're doing great.
Tell me you killed
Take your
someone.
time. You okay?
I am. I get frustrated when I can't do things, or at least it looks like it.
Yeah, you and me both.
Thanks, but my frustration manifests itself emotionally, and then I get upset, and then it looks like I can't handle things, and then I can't cry in front of the patient because no one wants to see their doctor cry. That's just a big red flag.
You just did a perfect Craig. You're doing great.
Hey, you, pasty white. How about a sandwich?
What brings you here today, sir?
I'm here for a fucking sandwich.
Okay. Okay, excuse me.
Perla?
Perla, can this patient get a sandwich?
I already gave you a sandwich, bro.
I ain't ate this whole week.
Sure, give him another sandwich. They're on the food cart. Just make sure it's not egg salad or he'll throw it on the floor.
Okay, good to know. Thanks.
Any quick ones up here? It's only 8:30 and Robbie's already on my case for being too slow. I can usually at least make it a lunch before he starts hounding me.
Cut a little slack today. Okay, it's the anniversary of Dr. Adamson's death.
That's sad. There's still no reason to take it out on me. I'm just saying.
Dr. Mohan,
Samira, please.
I just wanted to apologize. When my phone went off earlier, that was really unprofessional.
Don't sweat it. Trust me, we need to laugh, otherwise we'd never stop crying.
Thank you.
Besides, with all the craziness that comes through here every hour, nobody cares or notices.
Got an unresponsive, unhoused man coming in. Might be a good teaching case, funky music. Let's go.
Caucasian male, approximately 60 to 70 years old, found under...
Three! That's crazy.
What's going on? Patient tested positive for rats. No.
Yeah.
If it matters, I only counted 3. Oh, there goes 1.
Because your son tested positive for THC, the psychoactive ingredient in cannabis, we're gonna have to admit him for overnight observation and monitoring.
What about his brain? Is there a chance that much pot is going to do some damage? I mean, he's only 4.
The honest answer is we don't know. There haven't been any long-term studies, but the fact that this is a one-time occurrence suggests that there should be no long-term effects.
But you don't know. So my son could end up with learning disabilities, psychiatric problems, or even autism.
Calm down. Your son was never gonna be like Stephen Hawking. Calm your ass down. that would be me. You know, I will egg on. I will egg on, dog. I will push the buttons. I will make you mad. I will make you pissed off. I would make you pissed off.
Because there's no evidence to suggest any of that.
Hello, I'm Kiara Alfaro. I'm the department's social worker.
Kiara will help you navigate the next steps.
What steps?
Well, a case like this requires mandatory reporting to child services and sometimes law enforcement.
No.
Why do you have to involve the police?
It's a controlled substance.
They're not taking my kid away.
They were pot gummies.
Well, fuck your suggestions. No one is touching my child. In fact, we're leaving.
Well, you know, you can't take your son. He could stop breathing. He could have
I'll
a seizure.
observe him at home.
Amanda, please.
Fuck off, Drew.
Get security. If you can't cooperate, I'm gonna have to ask you to leave.
Amanda, please. He needs to stay here.
And you need to get a fucking hotel.
Your son can't leave the hospital, but I can have you removed.
Don't you dare touch me. Get out! All of you!
Mrs. Jones, I know this is scary and stressful.
Oh, fuck you! Fuck you! This is my son, and nobody is touching him.
Whoa, what's going on?
Mom's worried about his CYF.
Amanda,
Okay, enough!
Damn.
This is a hospital. This isn't the Jerry Springer show. Ma'am, nobody's trying to take your child. So why don't you stay here with him while your husband talks to our social worker outside and straightens all this out?
Well, I don't want him speaking for me and my son.
Well, it is either you or him. Your son is not leaving, but you can be escorted out and even arrested if you refuse to cooperate. Nobody wants that. So you tell us, what do you want to do?
I'm staying with my son.
Okay, great. You do that. We all on the same page here. Thank you, Olson. You okay?
Yeah, we got this.
All good.
It's all yours.
So, Mrs. Jones?
Is everything all right out there?
Yeah, just another day in paradise. How are you feeling?
Better. Where's David?
He left. He said he had to get back to school.
What?
Maybe you could try calling him. Get him to come back.
What's going to happen to him if I do?
Hopefully he'll be willing to talk to somebody.
Will you talk to him?
I can try. I don't think he wanted to talk to me. Have you shared with anyone about the writings of his you found?
No. I didn't know who to tell. I just don't want to see him get hurt.
Neither do we.
Get your ass back here. Sorry.
Just going straight to
See,
voicemail.
maybe if you can text him.
WTF. Dog. Where are you?
He's not texting back. Oh, I'm sorry about all this.
It's okay. It's okay. What you're doing for David is very brave.
Stupid.
I'm his
but brave.
mother. I'll do anything to protect him.
Do you think he would hurt anyone?
No,
Yeah.
I'm sure a lot of parents felt that way before their children did unspeakable things.
Does he have any history of violence? Has he ever been in any trouble?
No, never. He's very quiet. And he takes great care of me.
He's very quiet. Nowadays, that's a bad sign, isn't it? That's crazy. I was the quiet kid. You know what I mean? I just sat in the corner, drew like a little bit like paintings and stuff, talked with my friends, but I was kind of the quiet kid. Now I feel sad for the next generation of quiet kids. Man, you guys got it rough. These psychos fucked it up. Before, when you were quiet, you were mysterious. You know, you had an aura around you. Now, school shooter energy. Damn, bro. Damn, right? Sucks. It sucks, bro.
Struggled with his father's death. We both have it.
The flight is 10 minutes out with an electrocution.
Okay, grab Collins. I'll be right there. Keep trying to reach him. If you do, have someone come find me.
Okay. Thank you.
Of course. You got some good news for me?
I sure do. There are 2 rooms in ICU being cleaned. They'll be ready by now.
Great.
Oh, and I got bagels in the lounge.
Nice job. Thank you.
Is it true?
You have to be more specific.
Are there rats in the ED?
Apparently, if somebody already snitched.
Do you know how bad this looks? One more reason to shutter this place. Only the emergency department admits
The emergency
rats.
department would never admit rats unless they have the right insurance.
Did you catch any of them?
One, and I charge them for a full visit.
I'm glad you think this is funny.
I'm sorry that you don't.
Did you call an exterminator?
He's waiting on a second opinion.
You were pushing your luck today.
Don't worry. Last I heard, they were headed for the cafeteria, so they should be dead within the hour. I'll be here all week.
Or maybe not.
Drug-seeking woman kicked off a city bus for disrupting and disturbing passengers. She's been screaming for narcotics nonstop. We found an empty Percocet bottle
What the hell are you
5 days
doing?
ago.
Why can't you call it? She's been uncooperative and combative since we picked her up.
Let her go! Stop fighting! Calm the fuck down or I'm calling the cops.
My meds at home aren't working. Please, I have sickle cell.
Okay, stop. Everybody stop. Stop! What's your name?
It's Joyce. It's Joyce.
Joyce, is this your sickle cell pain?
Yes.
10 milligrams of IV morphine.
You really want 10?
Yes, repeat it in 5 minutes if needed. And she needs a dilaudid drip. This is a vaso-occlusive crisis. I'm so sorry this happened. You're gonna be okay now. Okay? You're safe here. Come on. You're gonna be safe here. I promise. Just breathe. Okay?
Live wire hit his left forearm. Shocked him once for VFib.
Was there a power pole down?
No, abandoned factory. We found bolt cutters at his side. Got electrocuted.
Try to steal copper?
Most likely. Power line fried his arm and the current through his whole body stopped his heart.
Ready? Steady, lift. Atomyoglobin and a CK to the labs. 2 liters normal saline.
Fun fact about me. I have an electromechanical engineering degree. What? You thought I was dumb, didn't you? Yeah, I got a degree. Yeah. Now, but seriously, one of the first things that they taught us, because we worked with like big machines and factories and all of that stuff, they don't use like 220 volts, 120 volts. They use stuff like 300 and above, right? So they taught us very carefully. Yo, this electricity shit is not a joke. It will destroy a human being. Sad enough, I saw that firsthand with my colleague. Like, when I say electricity tore him to bits, I'm talking about like his entire shoulder all the way down to his stomach got torn to bits by, I think it was 480, something like that voltage. Damn! Electricity is not a joke, especially with like factories and stuff like that.
Wide open.
Dr. Santos, what are we worried about?
Rhabdomyolysis from tissue damage can kill the kidneys. Ongoing risk of cardiac irritability.
Excellent.
AP pads in place.
This guy fell off a telephone pole?
No, he was on a platform.
Boring.
Cut into a live wire.
Hence ventral compartment.
Set up the stick pressure monitor. VFib.
All right, charge to 300.
Am I running this or are you?
Sorry, reflex response.
Clear.
Ah, fuck!
Sorry. Sorry. So what happened?
I bought it for my girlfriend's dog. I work nights and he yaps all day long. And when I woke up, I was wearing it. Stupid bitch! Go.
Sorry.
I think she must have used crazy glue.
Yeah, it looks that way. Have you tried removing the batteries?
Of course. She glued the case shut.
Damn, that's
All right,
ridiculous.
I think we have a couple options, Gary. We can try to find a solvent that will dissolve or at least soften the glue enough for you to peel it off without taking your skin with it. Or, Dr. Fadi.
I guess your skin cells on your neck will naturally slough off, and you should just be able to remove it in time.
How much time?
Couple weeks, maybe.
Couple weeks?
I think this guy's got scurvy.
Was he a pirate?
No, he's an unhoused man. Lives almost exclusively on dollar store ramen. There's parafollicular hemorrhage.
Question. Do you know that saying that it's like people used to say it a lot, where they say stuff like, I don't trust people who don't like animals? I'm kind of the opposite way. If you like animals more than you like humans, something's wrong with you, bro. Like, I know humanity sucks. I'm one of the first people that says that. But there is a specific kind of psychotic that I don't like, where they just focus so much on animals that they disregard the humanity 100%. It's like, what? They would literally step over a human being to save a puppy. That's the level of insanity that I'm talking about. It's like, okay, dog, I love animals as much as the other person, but still, like, that's a human being. You know what I mean? Like, that's crazy to me. Like, I don't get it. I don't understand when people are like, oh, I love my dog. I love my cat. I love, like, cool. You could like them. You could love them even. But to the detriment of another human being, that's insane to me. That's a level of psychotic that I can't even understand. Like, I remember this story, right? It fucked me up. It was about a guy in a certain country. I'm not sure that I could say it in this, maybe I'll get blocked. But in a certain country, and he's been starved, dead, all of that stuff. And he had a puppy with him, right? And he kept feeding the dog, and he was telling people if you could help in any way. People opened a GoFundMe, not for the guy who was feeding the dog and trying to survive in this hellhole, for the dog. Isn't that insane? They actually started thinking about a rescue mission for their dog instead of the human being. What? That's the level of psychotic that I can't even understand. Anyhow, just a tangent, just a weird thing to focus on, but it brought it up.
Gingivitis, bleeding gums, and no fruit or vegetables in his diet.
I suppose that could do it as long as you've ruled out piracy. No parrot, no peg leg, doesn't reek of sweat and rum.
Well, now that you mention it, there was a smell.
Probably a pirate. Tell him to pick up some vitamin C next time he docks at a dollar store.
I can't tell if you're joking.
No, Captain Scurvy's got a vitamin C deficiency. Cheapest way to fix it is with a daily supplement.
Captain Scurvy's another joke.
I'd like to think so.
It's a good one.
Dr. Langdon, Dr. King, this is Arthur Carlson from Children, Youth, and Families. He'd like to speak to the parents of Tyler Jones.
Right. Mel, would you mind showing him to Kiara and the family?
Yeah, right this way.
Beto?
Hello, doctor.
What are you doing here?
I'm working day shifts now.
Didn't you retire a couple years ago?
No. I have to work today.
Right. Just stay right here, okay?
I have a lot of cleaning to do.
Yeah, no, I'll be just 1 second.
Hey, Doc, how about a sandwich?
Sure, Earl turkey, no egg salad. I got you. Just give me 1 minute. So, Beto said he's working here?
Yeah, he just started wandering. Fortunately, he always winds up back here. Thinks he still works in the ED. I called his family. They usually pick him up after a few hours.
Really?
Yeah, gives him a break and look at him. He's talking to people, feeling useful, getting some exercise. Hell, I wish I was that happy.
Think he's any good at catching rats?
Stop.
Oh, Earl wants a sandwich.
Oh, always wants a sandwich.
Hey, check it out. I got my kids a puppy.
Cute. Hope that wasn't your idea.
Why?
Seriously? You really think your wife needs anything else to take care of?
Abby loves dogs.
I love penguins. Doesn't mean I want to take care of one.
Well, I'm pretty sure it's illegal to own a penguin.
Pretty sure you're missing the point.
The point is, Tanner promised he would take care of it.
A 4-year-old. Yeah, okay. How's she doing?
Still breathing after 20 of morphine.
How's the pain, Joyce?
Oh, a little better.
You've ordered an exchange transfusion.
Figured I needed that.
What's your normal regimen at home?
90 of extended release morphine every 12 hours and oxycodone for breakthrough pain, but it wasn't working.
Starting IV dilaudid at 4 an hour. You can press this button if you need a little extra.
That only works once an hour, though, so don't go crazy.
Could I confer with you?
Yeah.
You seem surprised by the opiate dosage.
Seemed a little high.
So was her pain.
How do you know she's not drug
You
seeking?
can't fake a hemoglobin of 6. Do you know what sickle cell crisis does to the body? Blood cells get caught and plug up your capillaries and deprive all your cells of oxygen. It's been described as an electrical stabbing pain that feels like it's breaking your bones and flushing glass through your body.
I never thought of it like that.
Little empathy goes a long way with those suffering in real pain.
Yeah.
Don't worry, you'll get good at spotting the fakers, and half the time all those people need is someone to really listen to them and hear their story.
Anterior compartment pressure is 49.
Burn caused massive swelling.
What does he need, Dr. Santos?
Fasciotomy, but he still has a radial pulse.
Pressure'd have to be over 100 to lose the pulse, and at that point, he'd lose the arm.
49's enough to destroy all the nerves and muscles in a matter of hours.
Compartment pressure is 49?
Yeah, gonna make the initial incision down here. Ortho can finish up in the OR.
Good plan. I'll let him know. Hey, Robbie.
Always good to see you, Fred.
Hey, like my rock star.
She's pretty good.
Yeah, she is a great
teacher.
Sterile gloves for Dr. Santos.
Oh, we don't teach forearm fasciotomies to our residents.
What if she's all alone somewhere someday with no backup? This is the path to avoid the median nerve and all major vessels.
Maybe just watch the first time.
She'll hold the blade, I'll cut. Templated Dr. Santos. We'll start proximal.
How much pressure?
Just about this much.
Damn.
Through the skin and sub-Q.
Looks like it's bubbling.
How are they making out?
They're still talking.
You okay?
Yeah, for sure. I just hate seeing families torn apart.
Oh, they'll be fine.
How can you be sure?
They're white. Probably get off with a slap on the wrist. If they weren't, she'd probably lose her child and he'd end up going to jail. But
Facts.
sorry, I did a fellowship in cynicism. You sure you okay?
100%. I'm just gonna get some air.
I am a savage, classy, bougie, ratchet, sassy, moody, nasty. I am a savage.
I need help. I got stuff.
Can you guys help? What's your name?
Alex.
Okay, Alex, let me take a look.
This fucking hurts.
Oh, I know. All right, we're gonna take good care of you. You guys got it? Up here, Alex.
I got you.
I have an abdominal GSW in the ambulance bay. Code trauma now.
GSW just got dumped by homeboy ambulance.
Okay, you got this?
Yeah, go.
2 grams of Ansep, ortho's on their way.
Accurate.
This is
Systolics only 80, 14 gauge, left AC.
We got 2 units of whole blood going on the rapid diffuser.
Call the OR, we'll be right up.
Lungs up.
Do you take medications every day? Any allergies?
No. Morrison's in full blood. See that?
Yeah. Tore up his liver.
What's his name?
Alex.
Alex, you've lost a lot of blood. You need to go to surgery right away.
We're gonna die.
Not now that I'm here.
Spoken with humility of a surgeon.
Owen's ready. How's he doing?
His feet's coming up a bit.
Let's go.
You call my mom? She's the ice on myself.
Of course, of course.
So he didn't have to wait for OR?
Nope. We're a trauma center. We always keep one OR stocked and ready to go.
Well, that's awesome. What happens if there are multiple traumas needing OR?
We get a lot busier.
Mr. Milton, I'm sorry we had to move you into the hall. I know it gets pretty chaotic and noisy out here. Mr. Milton? Hey, Bennett, wake up for me. Oh, shit. I need a little help here. Help!
When did you check on him last?
I don't know, around half an hour ago at most. I was waiting on labs.
What's going on?
It's my gallstone guy. You saw his EKGs.
Unknown downtime, he was sleeping in the hall.
Crash card, let's go!
I got it.
Hold compressions.
Asystole. Resume compressions. Amp of epi. Slow tempo.
Should I intubate?
No, drop an LMA. We don't want to hold compressions.
Pupils are fixed and dilated.
Been down a long time.
How we doing in here?
So much better. Dr. Mohan, this is my wife, Undine.
Dr. Samira Mohan, nice to meet you, Undine.
And thank you for helping her.
Of course. And again, I'm so sorry about how you were treated when you first arrived. Not everyone who works here is accustomed to dealing with sickle cell. We will be doing everything possible from here on in to manage Joyce's crisis. In the meantime, can I get you anything?
I'm fine.
Undine?
No, thank you.
Okay, well, have the nurses come find me if you need anything.
Take slow, deep breaths for me, Ian.
Order the neb, 5 albuterol, 125 solimedrol.
Keep an eye on him and present to Dr. Langdon? Okay. Okay, great. I'll see you back in triage once he settles down.
Yeah. Let's take this off. All right, hang in there, Ian. This should really help with your asthma.
How can I help you, hon?
I'm looking for Dr. Langdon.
Yeah, let me see where he is. Dr. Langdon, we have a med student at Central looking for you. Copy that. He's headed this way.
Thanks.
Hey, Crash. You missed a pretty cool fasciotomy.
I'm not sure I'd be describing a fasciotomy as cool.
You would if you were the one who did it. How's it going out in the arrivals lounge?
Do you know anything about Dr. McKay?
I've been here for less than 2 hours. I don't know anybody, including you. I thought you were some kind of kid genius.
I'm like any other third-year med student.
Clearly. Hey, I'm just trying to break the ice. I'm not trying to annoy you.
And yet, you're still calling me Crash when I asked you not to.
Really? You're still on that?
Still on that.
Yeah, okay. Sorry. Had no idea genius was so sensitive. But I get it. Big brain, big feelings. Makes total sense. I'll try to be softer.
Pustahan tayo ng $20. May masasampal isa sa kanila bago matapos ang shift.
Yeah.
So Dean.
Doug, I agree. The little one, I feel like she's gonna be slapping the big one.
We switch out every few minutes. You can take a break.
I'm fine.
Hold compressions.
Still in asystole.
Resume compressions.
Well, shall we shock him?
You don't shock asystole.
We could be fine VFib.
Not a chance.
Okay, when was his last epi?
3 minutes ago.
Okay, well, ACLS says every 3 to 5 minutes, right? So let's push another round.
Fine.
Robbie, Mr. Spencer's adult children are asking for you, and the parents of Nick Bradley, the fentanyl overdose, also want to speak with you.
3 rounds of epi and then call it.
Mr. Spencer's maxed out on BiPAP, 25 on 10.
Sats?
Not great, high 80s.
Hi. I heard you wanted to talk to me.
Yeah, that alarm kept going off.
Yeah, why don't we step outside? The alarm is for low oxygen.
Does he need more of that BiPAP?
I'm afraid that's as high as we go. So the decision at this point...
We want you to put our father on the breathing machine.
Nah.
Even though that goes against his desires to not be intubated.
We're not ready to let go yet.
Let go.
And if your father is...
Bring the serial killer.
He was a stubborn son of a bitch. He would never have given up on either of us. We're not giving up on him.
You're absolutely certain you want to put your father through this after everything I've told you? I may have to honor his advance directive.
No, you have to honor our durable power for health care. If not, we can talk to your hospital attorney.
Jeremy, you're on board with this?
Yeah, I guess so.
Okay, you can sit with him until we're ready.
And when will that be?
Momentarily.
Please don't tell me you're going to intubate that poor man.
It's what the family wants.
So what? They want to torture him?
I explained all that.
If I co-sign, we can override their durable power.
They're threatening to go to the hospital attorney.
Let them. Call the ethics committee. They'll agree with us.
No, you're probably right, but we don't have that kind of time. We are stuck.
What are you talking about?
Shit.
What?
I gotta go tell those parents their 18-year-old son is brain dead.
You want me to come with you?
Nope. It's okay.
What are you going to say?
I'm going to say that it's likely, but we still need to do an apnea test and a cerebral perfusion study.
There's no cranial nerve activity.
Those people need some hope.
Don't give it.
False hope.
Hope is hope.
Is it? What are we praying for miracles today?
They need time to process before they can accept what's happening.
You ever consider taking that advice? Physician, heal thyself?
Don't you have patience?
Dead. He dead. That's what he's saying behind the glass. D.O.D., man.
No. People wake up from comas.
No, dog. He
You can do that. You can talk. You can talk as that.
Kids, nothing higher than wheat. Remember that. Nothing higher than wheat. That's it. Don't do pills. Don't do nothing. If you ever gonna do something, stick with the normal stuff. Other people would tell you, don't do drugs. We know you're gonna do it. You know what I mean? We know you're gonna do it. But have a limit. Have a system in which you can, relax your brain, but also not go overboard with the whole pills things. Man, that's crazy. That's crazy. That's the one thing that I never effed with. You know what I mean? As a kid, a lot of people came to me with like stuff like that. They were like, hey, come on, take some. I'm like, nah, dog. My paranoia was just too high. I was like, I don't know. Because it's not like a scientist behind these pills. You know what I mean? They don't know anything about like measurements, quantities. They just put stuff in whatever and just give it to you. They don't. There is no customer service, So why risk it? Why risk it, bro?
No change.
No pericardial effusion, no tension, pneumothorax, no cardiac activity.
Let's try calcium. Could be hyperkalemia.
No, his potassium was normal.
You
You
effed
ready to
up,
call
bro.
this?
Not yet. Dr. Robbie said 3 rounds of epi. It's time. Let's push another amp. This one could do it.
Damn. This show really knows how to build up tension in the mundane of life. You know what I mean? Like, at the end of the day, it is a job. And one of those days that come to you that is constant, nonstop, just day in and day in and day in and day in. There's no out. It feels like there's no out. There's no, please let go. Let this day go already. I just want it out. If you've never had those days, man, lucky you, bro. But if you had those days, damn, it sucks. Where you just constantly putting out fires and you're just looking at the watch and it's just been 1 hour and you're just like, damn, where did I go wrong in my life? Anyhow, this show really knows how to build up the tension. I loved it. I'm going to continue watching it. Hopefully this time a much like faster pace because last one was 10 days ago. I'm going to upload it faster. Promise. Actually, I'm not going to promise because I don't know myself. Anyhow, thanks for watching. Enjoy yourself. Not that way or that way if you like. You know, do you, bro. Do you. It's your life. You freak.